Hi friends, are you a nurse? Are you looking for a nursing interview? Here are some questions and answers that is going to help you for your interview, and I have brought some of the frequently asked nursing questions in this video. So let's get started. An interview always start with a good introduction is given good marks to the candidate. So make sure you are preparing a self introduction which is containing each and every information about yours. So make sure you are adding your name, your qualification, whether you have done post BSc, BSc, GNM or MSc, and your year of experience and area of working and your strength. Your strength should be a good point that you need to add in your introduction. You can say you are a self-motivated person, you are a hard worker, you can adjust with every situation, you can understand others, etc. Additional qualification is like if you are holding any additional qualification like telemedicine, BLS, ACLS, or any other extra qualification or any extra course you have done, that also you can add in this introduction section. When you are attending an interview, please make sure you are learning the hand washing thoroughly. So you can say the WHO 6-step technique, that is world widely used hand washing steps. So the first step is palm to palm, right palm over left dorsum and vice versa. Palm to palm finger interlaced, interlocking the fingers and cleaning back of the fingers. Fifth step, rotational rubbing of the thumb and vice versa. Sixth step is clasped fingers rubbing to the opposite palm forward and backward and vice versa. These are the hand washing steps. Please make sure you are learning hand washing steps. Otherwise, you cannot win this game. Another question an employer can ask is route of injection. A nurse must know how to give injection and where to give injection. There are four common sites routes that we use for injection, that are ID, IM, IV and subcutaneous SC. ID is intradermal injection that is given under epidermis, that is on dermis skin, second layer, and IM injection basically given on three common sites, that is on the buttocks. We have to divide the buttocks onto four chamber and we commonly give injection on the upper chamber that you can see here. And another site that we use on thigh, especially for the kids, pediatric and newborns, on the thigh, that is called vastus lateralis. And the another muscle that we use is on the shoulder, that is on the upper arm, for three finger below the acromion process. That is all about IM injection. Then the another route of injection is IV. If we want to give an injection or IV fluid, we select IV. Intravenous, basically we use cephalic and basalic vein for IV cannulation. And subcutaneous, that is the third layer of the skin, that commonly we given around the umbilicus and on the upper arm as we said, but we use very thin needle, that is 26 gauge, and we can also give it on the thigh. Another important question an employer can ask is vital signs. You must know what is normal and abnormal values of vital signs. There are basically 5 vital parameters and the fifth vital signs is recently added, that is pain. Apart from that, heart rate, BP, respiration and temperature that we check. So the normal heart rate is 60 to 100 beats per minute. Anything less than 60 beats per minute is called bradycardia. More than 100 beats per minute we call it tachycardia. And BP 120/80 is the normal value mm of Hg. Less than 90/60 is called hypotension. More than 130/90 we call it hypertensive. And respiratory rate normal is 10 to 20 breaths per minute. Less than 10 breaths per minute we call hypoventilation. More than 20 we call hyperventilation. The fifth vital sign is pain. If the patient is having pain, then you can ask the patient how he is going to score it. So there is 0 to 10 number that we are giving. If there is no pain at all, then you will give 0 scoring. And 7 we call it is a severe or worse pain. So that is the number that we are going to give as per a patient's pain. So we call it numerical rating scale. In vital signs, temperature is the last parameter. Normal temperature is actually 98.6 degree Fahrenheit as per the fundamentals of nursing. So anything less than 97 is called hypothermia. More than 100 we call hyperthermia. You can also say it febrile, fever, pyrexia. There are so many names are there. And the most commonly asked question is code blue or CPR. And you can answer for this both question the same way. The code blue is an emergency code which is in cardiac arrest or a patient is about to get a cardiac arrest. And the second situation is CPR, the same thing. CPR is all about cardiac pulmonary resuscitation. And basically you have to remember 3 steps for easy understanding. First step is assessment. Second step is call for help. Third step is CPR. Let's go one by one. Assessment. Just remember, first you have to check the response by tapping the shoulder, shout loud and check for response, not more than 80 to 10 seconds. If there is no response, you will directly move to the second thing, that is check for carotid pulse. You will find the carotid pulse both sides of the trachea, and you have to check the carotid pulse not more than 8 to 10 seconds. If there is no response, no carotid pulse, you can go to the second step, that is call for help. For help, you can announce code blue or you can call for help calling the ambulance. The third step is you will directly start CPR. So you just need to remember the ratio of CPR is 30:2. 30 is about chest compression, cardiac compression, and the second is to rescue breath that you have to give. That is ratio 30:2. The most of the employer keep on asking one question, that is all about in a minute how many compressions that you have to finish. So the answer is 100 to 120 compression you have to give to the patient in a single minute. So there will be certain question also asked from some of the nursing procedure, and commonly asked questions are from IV cannulation, ABG sampling, blood transfusion, Foley's catheterization, Ryle's tube insertion and feeding. So let's talk one by one. From IV cannulation, they ask the size of the cannulas. So you can tell the size and the number coding. So please refer from Google to see the number and size. And another thing they can ask from IV cannulation is the complication. The most commonly seen complication in IV cannula is phlebitis. Phlebitis is inflammation of the veins. And another question they can ask is ABG sampling. ABG means arterial blood gas sampling. Definitely it is a blood sample, but it is taken from artery. The commonly used sites for ABG sampling is radial or from the femoral arteries. So as you can see, it is a radial artery puncture. So that is all about, I am going to talk about ABG. Commonly asked question about blood transfusion is how much time it will take to finish a blood transfusion. That is 3 to 4 hours we take to transfuse a entire vac. And another question they keep on asking to the people is about if there is an reaction occur during blood transfusion, what a nurse must do first. The answer is stop the blood transfusion. Second, call the doctor. And 3, carry out the doctor's order. That's all about blood transfusion that you need to remember. And And another question they can also ask about blood transfusion is which cannula size is preferred to give blood transfusion. Then you can say only 16 or 18 gauge of cannula we have to put before giving a blood transfusion. And let's talk about Foley's catheterization. Commonly they ask what all the things that we need to arrange for a Foley's catheterization. So I again request you to refer that too, because another question they can ask about Foley's catheterization is how you care a patient with Foley's catheterization or indwelling Foley's catheter. The answer is you have to give Foley's catheter care every shift with soap and water. So let's talk about the Riles tube insertion and feeding techniques. For Riles tube insertion, they may ask you about the measurement, how you measure before inserting the tube. The answer is like this. You take measurement from the tip of the nose to the earlobe, and from the earlobe you will take the measurement till the epigastrium, then only you will insert the tube. And another question they can ask about the feeding. Before feeding, what position you have to put the patient to? Then the answer is high Fowler's position or a sitting position is the preferable position for Riles tube feeding. After feeding, you have to put the patient into left lateral position. Let's talk about frequently asked diagnosis. These are the commonly asked questions. COPD means chronic obstructive pulmonary disease. It is a group of lung disease where in this condition patient's airflow is obstructed and cough, shortness of breath are the symptoms, and the treatment is bronchodilator and steroids. Now let's talk about appendicitis. Appendicitis is the inflammation of the appendix. Pain in the right lower abdomen is the symptom, and the treatment is probably appendicectomy is the treatment, which is a surgical procedure, and some of the patient very rarely receive a medical treatment as well. Dehydration, reduction in the amount of water in the blood. It can happen due to excessive fluid loss like diarrhea, vomiting, or any other reason. Low urine output, thirsty, dry lips, dry mouth, dry eyes are the symptoms. ORS and fluid replacement can be given as a treatment. Diabetic mellitus, increased sugar level in the blood, high blood sugar level, polyuria, polydipsia are the symptoms. Hypoglycemic agent like insulin and tablets can be given for this diagnosis. Hypoglycemia, which is low blood sugar level in the blood, less than 70 mg per dl. Sweating, thirsty, fatigue are the symptoms, and oral glucose, IV dextrose can be given as a treatment. Now let's talk about hypertension, which is increased BP more than 114 by 90 mm of Hg. When patient is having hypertension, they may experience nausea, headache, irregular heartbeat, etc. Antihypertensive drugs and diuretics are the main treatments that is given to hypertensive patients. Now let's talk about some normal blood values. HB, that is hemoglobin, 12 to 16 gram per dl is a normal value. TLC, total leukocytes count, 4000 to 100 microliters. Platelet count, 1,50,000 to 4,50,000 platelets per microliter. Sodium in blood, the normal value is 135 to 145 milliequivalent per liter. Potassium, serum potassium is 3.6 to 5.2 millimoles per liter. Creatinine 0.7 to 1.3 mg per dl. Blood sugar fasting 70 to 100 mg per dl, and blood sugar random 100 to 140 mg per dl. Another question an employer can ask is NSI. If you are going to attend an interview from NABH or JCI accredited hospital, NSI would be a important question. So NSI means needle stick injury. Needle stick injury means if you are getting a prick from a used needle or from a sharp. So first thing you have to do is wash your hands under running water with soap solution. Do not panic. Do not squeeze. Do not suck the area. Report to your ICN. After that, or you can report directly to the emergency department, and they will give you some vaccinations if you're not vaccinated against HBsAg. Then they will send some of the blood tests from the person who got needle stick injury. Then they will also give some of the treatment and follow-up care. Some of the employer also ask about emergency drugs. You just need to remember 4 5 drugs. Saving drugs that we call is adrenaline, atropine, xylocard, calcium gluconate, and soda bicarbonate. And you can also remember midazolam for this interview. So these are the main questions that they are going to
If you
ask.
really like my
And
video,
I wish you a very
share,
best.
like and subscribe. Thank you so much and all the best for your interview.